Hi Bio4, welcome to part 4 of respiratory. And we'll continue on with the larynx. So here's Paul. The sound coming from the larynx is formed into words, right? We can sing, we can speak, and that's because we're using the pharynx, we're using the size of the oral cavity, we're using the tongue, and we're using the lips. So it's not an easy thing. There's a lot of things going on when you're trying to sing, when you're trying to make sound. The larynx is also important in swallowing. So look at the pictures. I'm going to show you pictures of how the tongue forces the bolus into the oropharynx. And then the larynx is elevated. The epiglottis is going to close over the glottis. And then the pharyngeal muscles are going to push the bolus into the esophagus. And then the larynx will go back into its normal position. So let's look at that in pictures. So here is vagal. It's bolus. The bolus is just anything chewed. So anything chewed is coming down here, and it's going to come down, and it could go into the trachea here. And this whole region is the larynx. Remember, if it has cartilage, it's the larynx. And more specifically, the epiglottis is part of that also. So let's see it in pictures then. There you are. You've pushed it to the back of your mouth, and now you're swallowing, and you have put this up and over. So the epiglottis is closed to the trachea, and now you're swallowing the bolus or the vagal. And once it's gone past that opening, the epiglottis will open back up again. Okay, so if you have to go back and read the sequence of those, you can do that. So we would move on then to the trachea. We've gone past the larynx and we get to the opening of the trachea now. So we're going to say the trachea extends from the larynx to the primary bronchi, where it's going to branch out. So your trachea, your windpipe, and remember it has incomplete cartilaginous rings because you don't want it to bump up against the esophagus. It's lined by mucus because that mucus-producing epithelium, those goblet cells, are going to be dumping mucus into that area so it doesn't dry out. And this is going to allow for the passage of air. So here is the drawing then. We start out thyroid cartilage, the cricoid cartilage. This is all, these are going to be making up the larynx. And I'm coming down the trachea now until it's going to branch to go to right lung and left lung. And then it's going to have to branch again to go to the lobes of the lung. So here then we're going to have one lobe, two lobes on the left, and 1, 2, 3 lobes on the right, as it continues to branch. If you look at it in cross-section, you would see the lumen, you would see this mucosa, and it's ciliated, remember? And those goblet cells are going to be putting mucus into this region here of the lumen. And here's your hyaline cartilage. Remember that from a long time ago. Now, posterior here to the horseshoe of cartilage is a muscle. So there is a muscle there. It's not completely open. Okay. This is what it would look like, the respiratory tree, if we could actually sort of inflate every one of those little small branches. It's very impressive to see. Okay, so how do we call the branching into the bronchi and the bronchioles and the alveoli? So the trachea divides into primary, right and left bronchi. One bronchus, two bronchi. And air is going to enter the lungs then. The primary bronchi now, that first division that goes into right lung, left lung, is going to divide into secondary bronchi. Good word for it, easy to remember. It branches again into the lobes, correct? So each lobe of the lung receives its own secondary bronchus. 3 lobes on the right, 2 on the left. Okay, we got that straight. The secondary bronchi now, they're going to divide into tertiary bronchi because now within that lobe it's going to start, branching out to be able to reach the whole extensive region of the lung. So it's going to pick up as much oxygen as it can. And then the tertiary bronchi are going to divide, and hence that picture that I showed you with all those tiny little divisions. And it's going to give rise to these tiny little bronchi, and you know by now that eoles means small, so it's going to give rise to the bronchioles, the little guys, which will then finally reach sort of the end of that road. And that end of the road is going to be called the terminal bronchiole, which then finally divides into where you're actually going to, where respiration's occurring, right? Which is the respiratory bronchiole. Okay, so secondary to tertiary to many bronchioles to terminal to respiratory. So I'll show those to you in a diagram in a little bit. The respiratory bronchioles divide into ducts which end in the alveoli, and that in the alveoli is where exchange of oxygen is going to happen, not before. Okay, all that is a respiratory tree, the whole thing from coming down from the trachea all the way to the alveoli. Okay, this is a picture then. Trachea, primary, left primary bronchus. Then these are going to be the secondary as they go into the different lobes. And then those are going to branch again, and they're going to be tertiary, and then they're going to branch and branch and branch and branch and branch until, where we want to reach here is the alveolus, right? This little grape-like structure, the alveolar sac. So the last branch is the terminal one. You've arrived at the terminal. And the one that is actually feeding into the alveolus, let me get my pen here, is the respiratory bronchiole. Okay, terminal is you've reached the end of all this branching. Respiratory is it's actually coming into the alveolus, which is the site of oxygen exchange. I'm going to skip that. As the branching of these bronchi occurs, you can no longer have a lot of cartilage around them because they become so tiny. So those rings of cartilage disappear, and what you start seeing are little tiny little pieces of cartilage sort of stuck on the smaller bronchi or bronchioles. And what increases is the amount of smooth muscle, and the cartilage decreases in the small ones, in the bronchioles. Now, you probably have heard of spasm of bronchioles, and this is what happens to an asthma patient, an individual with asthma. Those small little bronchioles can actually spasm and close a little bit. And if they're closing a little bit, it's hard to get air through them, right? And it has more smooth muscle, so it can do that. It can actually vasoconstrict. And less cartilage, which is keeping them open, right? Cartilage is going to keep it open. And if you diminish the cartilage and increase the muscle, there's the chance of that actually closing up a little bit. Finally, we reach the alveoli, plural, alveolus, singular. And it is this little ball here that is made up of a very thin wall of one cell thick, because we want oxygen, right, to be able to exit. It's coming in, you want to exit this membrane that's just one cell thick, and you're going to want to pick up CO2, but let's just leave it at this right now. Okay, so that's the alveolus. If you were to see a picture of many of them, this is how it would be. You would have right here, you would have the terminal bronchiole, the last branch. And then the one that feeds into the clusters of grapes is the respiratory bronchiole. Okay, and all these alveoli, all side by side. So let's stop there, and then we'll continue on talking about these structures. Thank you. Bye.